So first of all, I would like to ask for your permission, all of you, to use this video for educational purpose on the internet.
Yes.
Okay, tell me first of all, what were your symptoms and how long did you have those symptoms before the surgery?
Oh, it developed over many years, but the last 3-4 years it was just became so ridiculously intense.
Can you
Well, it got to be where I couldn't walk hardly at all anywhere, so I just didn't have a normal life at all.
How bad was the pain? 1 to 10?
Oh, often it would get to a 10.
Okay.
And and then of course, I had to sit, and I became very sedentary because sitting was more comfortable.
Which was the pictures before the surgery that shows you had between L1 and L5 scoliosis of 45 to 47 degree when you are in the down position. When you stand up, that actually gets worse. You have this severe lateral listhesis, bone is on bone, and this was the finding before the surgery.
I finally went to a surgeon,
Okay.
and he thought I would need 7 levels corrected.
Mm-hmm.
So then I decided to go to the Mayo, and I went to the Mayo, and
What did they say?
they said that no, they would have to do my entire spine. It would be a 2-day surgery. That I would be in a care center for 9 months, in a body cast for longer, and it sounded just so debilitating, with no hope of it being for sure successful.
Yeah.
So
And so they wanted to do a 2-day stage surgery and do much more surgery. No, we did the surgery just about a month ago, right? And that surgery that was just about a month ago, we did it under actually 3 hours, about 3 hours, and we had about 280 cc of blood loss, and this is the result of that surgery that we did. Your cob angle, as we call it, went from 45 or 47 degree to 14 degree, and where the bones were touching each other, they are now separated, so the area between them where the nerves are coming out are separated, and as you see, the bone is not touching the bone anymore, contrary to before the surgery where it's bone on the bone. Here the bone is on the bone, and here the bones are separated, and here we see that those screws, even though your spine is significantly twisting, if you go to the other picture, I think what is very important here, that is for some of my colleagues that are really scared of doing this kind of surgeries, look at how your spine is side twisting, not only bending, but it literally twisting. This bone should be down here, but the entire spine is twisting. And here we see that you're significantly corrected, and your cob angle is now 14 degree, and all the screws are actually in perfect position with this minimal invasive technique. We got a picture of your back, and it's actually healing pretty well. And this was a big surgery. This is as big as it can get. How are you right now? How's the back pain?
my back pain, my spine pain, there is none.
Okay.
But I'm having that nerve root pain.
Yeah, and the nerve root pain that we talked about before the surgery, what did I tell you before the surgery about that nerve root?
That there was a 15% chance that I could get it.
Every level that you push the nerve to the side. How was that nerve pain right after the surgery? How is it now?
Oh, it's significantly better.
Okay.
And at first it was like, why did I let Dr. Abbasi do this? But now it's much better, and I've kind of figured out how to take my medicine to kind of help me through that.
Probably activity is a big part of it. I mean that, we have this result you just described just 1 month after this kind of big surgery, so we are very actually progressed, and I'm pretty happy with the results so far.
I am too, and
excellent. So
I'm just expecting it all to get better each day.
With time. Time. Obviously, nothing going to happen. Nothing in our spine happens in just
it didn't happen overnight this way.
It didn't. From your perspective, from the family's perspective, from the way you looked at her before the surgery, let's say the last 4 months before the surgery, and now this week, if you would compare it, what would you say where she is?
Oh, it's 180 degrees, really. She was a physical train wreck before the surgery.
Mm-hmm.
With, you know, most of it at that point with her back and everything. So to see her progress at this point, it's pretty amazing.
Excellent. Well, I'm happy to hear that. The job is not done though.
Mhm.
We're just 4 weeks out of that big surgery. We have long way to go, and we have to be careful. We have to do physical therapy. We have to take care of yourself. You have to take care of yourself rather than other things that are not initially important to your healing.
Mhm.
And we will, down the road, we will just do the same. We get new films, we get a new exam, and it's just going to be a path. But we are going to go that path together. Okay?
Okay.
Any
Okay.
question for me?
No, I thank you very, very much, and more people should be doing this surgery. I
Thank you.
truly believe it.
Thank you.
Thank you.
You're welcome. Thank you. Thank you, Mike.